Dr. Ester Piñero, physiotherapy at the Capnergy Medical Barcelona, Spain. Dr. Ester, you can share your screen.
Hello, everybody. I'm Ester, one of the physiotherapists of Capnergy's team. And today we're going to talk about the osteoarthritis, more in concrete, the knee pain. And for that, I will use a presentation that you will see in all the time. And I will be explaining you how is TECAR therapy useful for all this area. Okay. Then we are going to start with the presentation. Here we have. Today we are going to talk about TECAR therapy and osteoarthritis knee pain, and how TECAR evolution can be useful for this pathology. We know that we are talking about TECAR devices that are TECAR evolution devices that have several characteristics that are very important to know what we are doing. And we are talking about devices that can do treatments in automatic, treatments with 2 electrodes at the same time, crossfires, treatments that we have sensor of temperature, then we can see the temperature all the time that we are doing the treatment. Treatments with a lot of power. Then I want you to know that we're going to explain all this area or these pathologies with a device that is a C200 of Capnergy. It's a device of 620 watts of power. Then we are talking about a machine that is very powerful, and it's a machine of 2 channels. Then we are talk here in the presentation. You can see how we can do a treatment of a knee. One moment in an automatic treatment, and the other side, we have a manual treatment. Normally, we combine these 2 types of treatments. But well, first, we're going to make a summary of what we are going to do today. We are going to talk a little bit of an introduction of the pathology and what we have, the TECAR therapy treatment objective, for what it's useful, and the biological Capnergy treatment effect. We want to know the physiology, why it's useful as TECAR therapy for an osteoarthritis, arthritis of the knee pain. After we will see a clinical case. It's a post-surgery of a knee that has similitudes with a case of osteoarthritis. Then it is useful to know how it is and the conclusions. Then we start with an introduction. We want to know what are the principal symptoms of a knee when have an osteoarthritis. The principal symptom, the pain, okay? But we know that this pain can be worse when the activity continues, and it's worse when we do stairs or something like that. Also, we know that when the patient stops of doing nothing with the relax, it's a way of being worse this pain, and over time it's worsening also. Normally, when we rest, it goes better, and it goes better with medication, anti-inflammatory medication, and with cold, with both cold, and it's important that we know that also for the quality of life of the patient, it's very important to treat because it's very a symptom that we have. The patient decrease the quality of life of this patient. Then, when we talk about TECAR therapy, in all these symptoms we talk about an osteoarthritis, we want to know what objectives are useful for that, okay? TECAR therapy have different objectives. One part in osteoarthritis is to decrease the inflammation. Another objective we have is to decrease pain. Another thing important is the improve of the trophies of the tissues that are affected. And another thing important is to stimulate the generation of collagen and elastin to have a good skin and a good tissue, okay? With elasticity to move, okay, this joint, okay? Then, now we are going to see how the physiology explain all these types of objectives. The first objective we have is decrease the inflammation. We know that the wave or radio frequency makes an input in the macrophage, and this stimulates the improve of the anti-inflammatory cytokines, like interleukin 1, interleukin 4, interleukin 6, and 10. And also, we know that it may cross the factor of necrosis tumoral. Then, all these cytokines are anti-inflammatory cytokines, and we improve this area to reduce the inflammation that we have, okay? The other objective that we have is the pain, decrease the pain. We know that TECAR therapy makes an input in the nervous system, makes in the parasympathetic system, then we relax. Another important thing is that we make an input in the trigger points and in the pain of trigger points. And this is very important thing to explain because we have an influation on the cell. We know that when we have a trigger point, it increases the entry of sodium into the cell. Well, with the radio frequency, we know that this sodium, this action blocks the entry of sodium, and then it makes decrease the pain we have. Then we know that with the effect of the radio frequency that are electrons and protons makes change in this capacity of the electrons and make change the sodium that we have in the cell, into the cell. Then when we decrease, is when we block this entry of sodium, it's when the pain is reduced. Then it's very important this because we know that also one important thing is that the radio frequency make higher the endorphins in the like a neurotransmitter, the endorphins increase. Then we know both things. One thing is the pain of the trigger points that we reduce thanks to the entry, to the blocks of the entry of sodium, and also because we have a stimulation of the nervous system that reduce all this pain because we make increase the endorphins we have. The third objective we have is the increase of the trophies of the tissues that we are affecting. We know that when we make an effect on the macro and also we increase these anti-inflammatory cytokines, we make grow fibroblasts. And then when we have an interaction of fibroblasts, we make grow two things. The vascular growth factor, that it's one thing that we interest now. And the other thing is the next point, we will talk about the creation of tissue, okay? But now we're interested on this vascular growth factor. We know we are right to increase this vascular growth factor thanks to the stimulation of this cell, thanks to the stimulation of the macrophage, and then thanks to the generation of fibroblasts that makes growth all this vascular growth factor. Then we know that when we make grow this vascular growth factor, we make an angiogenesis of our tissues. Then we increase the blood in all the tissues that we are feeding, and it's a good thing to have a good arrive of blood to the area, okay, to apport more oxygen, more nutrients to this area, and also because we want to have a good trophies of the muscles that are around this knee, okay, all quadriceps, all ischios, that we need that we have all these muscles with good trophies to have a good contraction and to make grow the strength of the patient. If we have a leg with good strength, we know that we have more stabilization of our knee. Then we know that we need one thing, that is have well all this joint, and if we have blood, we can make a good nutrition of all this area or of all these structures we have inside the knee. But also we know that if we have a good trophies and a good vascularization of the muscles, we will have more stabilization of our knee also. Then it's important for two things. One, to work on the muscles, and the other one to work on the knee. Then the fourth objective we have is the creation of collagen and elastin. And it is very important that we know that when we make all these points of macrophage generation, that these cells and the cytokines that make grow the fibroblasts. Other things that another thing that we have is more production of growth factors in the fibroblasts. Then there we need to make grow the temperature till 42 degrees. And then we produce this collagen, and not only this collagen, also hyaluronic acid and elastin. And this is very important to create new tissue, or to take the tissue that are not okay and put a good tissue, a good fibers of collagen in our structure. In this case, in the knee. Okay, we know that we treat the collagen type 1 and 3, and when we have an osteoarthritis, we have pathologies on the type 2 of the collagen. But we know that we have several structures there, the ligaments, the tendons we have involved in all these joints, that we need to have it okay. Then we will not restore the type 2 of collagen of the inside the knee of the joint, but we will restore all the collagen of all the structures that are not the cartilage. Okay, then this is very useful to have a good content of the knee, of all the knee. Then with these 4 points, we have reduction of the inflammation, reduction of the pain, and we can have better nutrition of all the joint. With all this, I can have a better recovery of the lesson, the pathology I have. I want you to see it in a clinical case because I want you to know very well what we are doing. Here we have a case, a post-knee surgery treatment with a C200 of TECAR evolution. And here we have a patient that they do an intervention because of the unfunctional way of the knee. And the things I want you to know is that this is very similar to when we have an osteoarthritis, because we have pain, inflammation, limitation of movement, okay? I know that we are talking about here an acute process, and with an osteoarthritis of knee, we are talking about chronic thing. But what I want you to know is that with TECAR therapy, we can work in both moments, in acute and in chronic. Then it's for that I show you these similar things, because I want you to know that this person only in 3 weeks have a very good reduction of the inflammation and a very good condition of strength. We will see right now, okay? Then if you see in the photos, we see the reduction of this inflammation. Another important thing is all the tissues that we have involved there, we have restored. When we talk about the collagen and the elastin, it's very important for these scars and all that, okay? And it's for that here we have a good thing to know. Here we see all the perimeters that we are taking. This is a case done by Karina Fortuño, one of the physiotherapists of Cabernet team in the clinic. And you see in the photos the difference between the first session and the last session. And here you see how it's reduced the inflammation. The important thing I put on the right column, the difference between the first and the last session. And you have here also, Karina compares you with the left leg, the right back one. Then the important thing I want you to know here is that the big decrease of the inflammation of the leg is not till the 3rd week. It's not that. It's in the 2nd week that we see this big reduce of inflammation. Then we know that TECAR, it's very quickly to have effects because the big amount of this, if you see the on the patella, it's the point that we see more different in the inflammation. You see that between the 21 of January till the 2 of February, we have a difference of 4 centimeters. Then it's a very good thing in 1 week, okay? And this is important. Then also here you see the strength of the patient. The line you have down, it's the way that we have the vastus internal, medial, and lateral the first day. And the other ones, it's the comparison between the right leg, the left one, with the last day they have to do the treatment. And in 3 weeks, we have a very good condition of this strength, because if you compare, you have very similar strength between the right leg and the left leg, between the first and the second and the last treatment. And then this is very important because we have in 3 weeks recover the strength of the leg. And this is very important for the osteoarthritis, because when you have osteoarthritis, if you have a weak leg, then you will not reduce all the problem you have on your leg. Okay, then this is a good thing to show you that it's a very good thing to treat with TECAR therapy, because we are making a work in the muscles, and then we can improve very well this strength in a short time of work. Also, I have to say to you that we combine, during this treatment, Karina combined the treatment of TECAR therapy with exercise and all that. But it's for that this patient makes up very quickly the strength, because it's combining a good work of strength with the TECAR therapy. Okay? If you have a good nutrition of the muscle, when the muscle works, will make more contraction, more quality of contraction, and then we will win very well this strength. In conclusion, what I want you to know is that TECAR evolution, Capener's TECAR evolution, is a technology that allows you to combine automatic treatments with manual treatments with exercise treatments. Then it's a technology that it's helping you, but for different sides. Then another important thing is that you can work in acute moment of this osteoarthritis, and also in the chronic moment of the osteoarthritis. It's sure that you have to work different, because you have different objectives in both moments. Maybe in acute moment you want to reduce pain more than to win strength, but it's important, both things, to work in it. Another thing important is that Capener's TECAR therapy is useful for a big amount of objectives we have in our treatments of the knee. You are not only treating the pain, or you are not only treating the inflammation. No, you are treating pain, inflammation, trophies, stimulate the collagen if you have scars, or if you have limitation of movement, to make more flexible these ligaments. Then there are many objectives you are treating that are useful for it. And another thing is that improves the cells trophies, favoring current healing and avoiding adhesions and fibrosis. This is very important, because if you don't use a joint, well, part of the body, you will have less quality of life on the movement of all these parts. Then you can create adherence and have fibrosis. Then TECAR therapy is useful for this also. If you have a chronic pathology that make fibrosis and adherence, you can treat also with TECAR therapy, because we will have a good evolution of this fibrosis. And the most important thing I think about Capener's treatment is that it allows you a satisfactory, non-invasive treatment with a very far and good results. Then the patient will be with a lot of satisfaction, and the only thing that they feel is heat, comfortable heat. Then you will have a very good results with no any incidents or problems, very easy to do. Okay. Then if you want more information, write us, tell us, write to our distribution in Egypt, and we'll be very happy to answer all your questions. Thank you very much to be with us.